1440 KVON 99.3 The Vine. This is Kelly, and it is time for Healthy Communities with St. Helena Hospital. My guest this morning is with the Coon Joint Replacement Institute, Dr. Brian Blackwood. Welcome to the show.
Thank you.
It's great to have you here. Tell us a little bit about yourself, Dr. Blackwood.
I'm the newest member at the Coon Joint Replacement Institute. I'm their first fellow, so I was trained by Dr. Coon and Dr. Friedhand. I'm originally from Montana, and I was most recently in New Mexico, and then did my medical school training in the University of Washington up in Seattle.
When did you join us here in Napa?
I moved into Napa around August.
So you're brand new.
So yes, very new.
Oh, welcome. It's great to have you here. Well, tell us a little bit about the Coon Joint Replacement Institute. You primarily you're doing partial and total knee and hip replacements. Is that what you're doing? Yeah, we tend to focus on hips and knees, trying to treat arthritis in the community. So we end up doing mainly hip and knee replacements, both partial and total knees, and then total hip replacements usually. All right. And so how many of those have been done at the Coon Center? I think we've done, it's an average of about 1,200 a year. Wow. That they've been doing there. So we do quite a few. It's probably in the thousands now that we've had successful outcomes and happy patients. So tell us a little bit about what you offer, what sets you apart. Okay. I think the biggest thing when we look at the Coon Joint Replacement Institute is that we try to focus on minimally invasive techniques. So we try to, it's not a painless procedure, but we try to reduce the pain as much as we can and try to get people to activities. I think the thing that sets us apart most is most of our patients stay overnight for just one night and then are able to go home after that. Most of our patients don't have to go to a rehab facility. They don't have to go to a nursing home. In over almost 1,000 knees that we did last year, 90% of the people were able to leave after one night and to not have to go to a nursing home or a skilled nursing facility. So what does that mean by partially or less invasive? Is that what you were saying? Yeah, we say it's kind of less invasive. The term is minimally invasive, but it's kind of a bad term to use really, because then that focuses on the length of the incision. And it's not so much the length of the incision that matters, it's what you do underneath to the muscles. So we try to avoid cutting muscles in the knee replacements as well as in the hip replacements. That's why. So is it different equipment that you're using to be able to do that, or just different techniques? It's slightly different techniques. The equipment that we're putting in, the implants, are the same that any other surgeon would be putting in. Okay. We use different techniques as far as trying to damage the muscle less, and then we use a lot of advanced computer navigation and robotic assistance to try to give us the best outcome that we can have. Well, that's interesting. So what's the navigation? It's like a GPS for the... Yeah, it's kind of like a little GPS thing. So yeah, and we use it predominantly for the knees. We're able to computer navigate, and that gives us the optimum alignment for the implants. So we're able to put them in so that they can last as long as that they can, is the goal. And when you say robotic surgery, I mean, I'm picturing this little robot in there. What does that mean? What's going on? No, a lot of people think that, that we turn on the robot and go have a cup of coffee, but... Break time. But no, we're right in there. It sort of is a guiding hand. It allows us to do, so computer navigation is on one level, and then the robotics takes that up a level. We sort of say it's almost like computer navigation on steroids or a GPS. So the robot will actually control and make us color inside the lines, basically. Okay. So it allows us to make curved cuts and to really sculpt the bone and to actually be very bone sparing and very soft tissue sparing, which allows the patients to get back and do more activity. And then if we have to do this on younger patients, then that preserves bone for if they need to have a future surgery. So talk about who might need either a partial or total knee or hip replacement. The baby boomers are the ones who are sort of coming into the system now, and you want to think about if you're having pain in your knees or hips. If you're having pain in your knees, that's pretty easy to identify. If sometimes it's on the inside of your knee, and almost 90% of cases the pain starts on the inside of the knee. It can be under your kneecap or even on the outside of your knee. And many times this can be treated non-operatively with just some anti-inflammatories or weight loss, exercise. Bicycling is great. I've noticed a lot of people do that in the valley. See, I thought that was bad for your knee. No, bicycling is actually really good for your knee. Because you're strengthening the muscles. Yeah, because you're strengthening the muscles, and it's non-impact. So you're not doing the repetitive impact like running. Running is rough on the knees. Right. So we recommend that people do elliptical, bicycle, swimming, things that take the weight off of the joint but still allow you to strengthen it. So if someone is having pain in their hip or their knee, are they going to go to their primary care first or go to Coon Joint Replacement Institute to be evaluated?
I think the best place to go is to your local primary care for an initial evaluation, just to kind of get an initial X-ray, maybe try some of the anti-inflammatories. Sometimes you can get an injection of cortisone, or they have this visco fluid, which is actually sometimes made from the comb of a chicken, from a rooster comb. And some people get some good relief from that.
Yeah.
If that stuff stops working, and you've tried everything, and it's, if it's time to consider surgery, then that's when you come up and give us a call and consider.
Okay. And so when you say baby boomers, or you're seeing a lot of baby boomers, you're saying that it's mostly just due to age? We're talking injury? We're talking arthritis?
It can be due a lot to age. There can be a lot of reasons that we just don't understand why it happened. And it can happen in patients in their 40s. It can happen in patients in their 90s. And it's just sort of a spectrum. It can be from an early injury. It can just be from sort of chronic overuse, or it can just be bad luck. As you age, putting more stress on the joints. And if we're really trying to find out why this is happening, but we haven't come up with a good reason yet.
That's interesting. So it's maybe you're not seeing people who work out more, or runners maybe, or...
No, and we see a lot of people that do that, but there's a lot of people that run for years and years and never have any problems. Right. And then there's people that don't run all that much, or we're getting an increase as the people in the in the United States get a little larger. You put a little bit more strain on your back and on your knees and hips, and that's contributing to the increased need for hip and knee replacements as well.
And how common is joint disease? How much are you seeing that?
There's estimated that we do about 1 million of these surgeries nationwide.
Oh my gosh.
Every year. So it can be fairly prevalent. And like we say, there's a spectrum. Not everybody who has arthritis is going to need to have their joint replaced. But it seems to be a growing problem.
All right. So if someone wants to set up a consultation with you or any of the other doctors at Kuhn Joint Replacement Institute, how can they do that? How can they find more information?
They can get more information from our website. It's a great place to go. It's napavalleyjointcare.org. There's a lot of information there. There's direct links to our phone number and how to get a hold of us. And we can set up consultations that way. We can get consultations direct from their primary care physician or their regular doctor.
That's great. Oh, thank you so much, Dr. Brian Blackwood of the Kuhn Joint Replacement Institute. We appreciate you being here and enlightening us.
Sounds good. I appreciate the time, and thanks for taking the time to talk with me.
Absolutely. It's Your Healthy Communities, brought to you by St. Helena Hospital.